Okay, thank you, everyone. We are live now.
Okay, we will pick up where we left off. May I have a motion to approve Dr. Olasolo Ojo as our chair for our 2021 year?
This is Tanya, and I make a motion to nominate Dr. Ojo.
May I have a second?
This is Mr. Larch. I'd like to second.
All in favor?
Aye.
Aye. Congratulations, Dr. Ojo. Okay, look forward to you conducting our 2021 year. Okay, now may I have any nominations for our vice chair?
I nominate Dr. Makapokini.
Okay, we have one nomination, Dr. MacArthur Kearney. I'm sorry. Is there anyone else interested in the position or any other nominations?
What about Dr. Benson? Will she be interested in the position?
Dr. Benson is an employee, so she cannot chair. She can't be on the board.
Okay.
Anyone else? With that in mind, may I have a motion to approve Dr. MacArthur Kearney as our vice chair for our 2021 year?
I make a motion to approve.
May I have a second?
Second.
All in favor?
Aye.
Congratulations, Dr. MacArthur Kearney. You are our vice chair for our 2021 year. We look forward to both of you guys' new leadership.
Thank you. Thank you.
Very good. Now we will move into item 3, our public comment. So keep in mind for our visitors and people who are making public comments, you get approximately 3 minutes. We will not make any comments towards your comments. Who is up first?
We do not have anybody registered for public comment.
No one. Okay, no one wants to comment at all on the strategic plan? All righty. So with that, Ms. York, we could move on to the financial reports.
Yes, ma'am. In your packet, beginning on page 6, you have the monthly financial reports, beginning with the statement of revenues and expenditures. At the close of November 30th, 2020, our revenues exceeded our expenditures by $130,847.51. Okay. On page 7 is a breakdown of the expenditures by program. I'll ask if there's any questions about any specific expenditures or program on this report. Okay, moving on to page 8. It's a breakdown of the revenues by source. Page 8 is state and federal allocations. And also at the bottom of the page is grants. On page 9 is reflection of the Medicaid collections and also our fees. On page 10 is a reflection of the fund balance that has been expended and also the county funds that we've also expended through November 30th, 2020. On page 11, we have the accounts receivable report that is broken down by program and also payer. And finally, on page 12 is the aging report for private pay, self-pay balances, broken down by program. And if there's no questions, that is the monthly financial reports for this month.
Thank you, Ms. York.
I had a question just for a second. I'm sorry. Sorry, Dr. Mann.
Oh, yeah.
I apologize. And again, maybe you can explain the operation. How does the fund balance interact with the COVID-19 monies and the expenditures and the amount that's allocated?
Well, the fund balance here is a reflection of the debt service that we have for the building. There's certain programs that, of course, earn program income. And so that we pay a portion of the fees and revenue received towards the debt to pay for the building here. And then there's a little bit of fund balance from the Pregnancy Care Management and Care Coordination for Children program that also helps support some extra temps to reduce the caseloads for the case managers. So the fund balance here is not representing anything that we're paying toward COVID expenditures. We have received state and federal funds for COVID. That's on page 8. So far, the state has awarded us a total of $1,042,067. And through November, we've actually collected $504,389.85. Of course, it runs a month behind the way because we always receive the state money reimbursement after the money has been expended. So that's for all of our COVID expenses so far. We've been able to use state funding. It's a mixture of state and federal funding that is funneled through Department of Public Health to us.
So on page 9, it says it's like 750,000 expended. Is that right? On page 7, I mean. Page 7.
Yeah, that's the expenditures, and then the revenue on page 8 is just going to reflect how much we've actually drawn down from the state. Of course, the expenditures on that page reflect what we actually expended in November, that we won't receive the money back until December. Because I do a monthly financial drawdown, and it's always for the month's prior expenditures. So that's why there'll be a difference between the expenditures and the revenues received.
Okay. Thank you. Always one.
You're welcome.
Thank you.
If there are no further questions, we'll now have Mr. Jones give us the environmental health report.
Good evening, everyone. For the environmental health report for fiscal year 2020, I have the following. Next slide. For personnel, we had myself as the environmental health director, 14 inspectors or field staff, 3 airman support staff, and 1 temp admin support staff. For our on-site general sanitation section, we conducted 927 site visits for septic and wells. We did 497 soil site evaluations. We issued 577 permits for septic and wells. We did 125 system repairs. 169 well sites were evaluated. We received and investigated 133 complaints for septic and wells. We took 408 water samples, wrote 151 pool permits, and did 151 pool inspections. We wrote 272 solid waste permit inspections. Those were like the solid waste trucks in the county. We wrote 394 tattoo permits and it's for inspection. And we did received 313 solid waste complaints. For our food and lodging section, next slide, please.
Sorry, we are working on getting the slide up on the screen.
For our food and lodging section, we conducted a total of 2,284 inspections. That includes child care institutions. Those are mobile food units, food buildings, push carts, schools. We also did 161 permits total for openings, including your child care institution. We did 599 site visits. We conducted 13 lead investigations, and we received 286 complaints in the food lodging section. If there are no questions, that concludes my report for environmental health for fiscal year 2020.
Does anyone have any questions?
And we'll send out a copy of the slides. Apologies for not being able to get them up on the screen, so that you guys will have, the board will have them.
Thank you, Mr. Jones. And now we have Mr. Jacobs is going to give us the update on the opioid use.
Hey, how's it going, everyone? Can everyone hear me?
Yes.
Hey, how's it going?
Yeah, yes.
I had submitted, okay, here it is. Okay. So I'll just wait for this to get in the full screen. But my name is Chris Jacobs. I work as the Human Services Planner and Evaluator 2 here at the Cumberland County Health Department. I also function as the CFORT coordinator. For those who don't know what CFORT is the Cumberland and Fayetteville Opioid Response Team. And I'll be coordinating that program. And I'm just going to give an update just on how the opioid epidemic is impacting Cumberland County and just provide status on CFORT and what we're doing going forward. I'll just wait for the it going to presentation view. Do you want me to I can go from here if you'd like.
Yes, let's do that first. So
Okay. Yeah, that's no problem. Okay, so just the scope of the problem here in Cumberland County. So the North Carolina Injury and Violence Prevention Branch, they tracked all drug data from 2009 to 2018, but specifically focusing on opioid data. In 2018 was the last year of the report. And here in Cumberland County, we had 403 total opioid overdoses. That's opioids either from heroin, from fentanyl, opioid medications such as Vicodin or Percocet, or codeine or morphine. Of those 403 overdoses, 74 people died. There were a total of 405 total deaths during the entire report from 2009 to 2018, with the majority of them, the overdoses and deaths coming in 2016, 17, and 18. From 2019 to 2020, there was emergency room tracking data where county by county, hospital reports the opioid overdoses that are people who OD and who go to the emergency room, and they're reporting back on that data. There were 191 overdoses from October 2019 to September 2020 just here in Cumberland County. Could you go to the next slide, please? And just based off of that data, so Cumberland County actually had the highest number of reported overdoses that were reported to the ER as recently as September 2020. Just historically over the last decade, we're routinely in the top 5 of the highest number of reports of ODs that are reported out of the emergency room. We also have a 6.2 per 100,000 resident unintentional opioid overdose death rate. The North Carolina state average is about 13.6, so we're a little higher than the state average there. So as you can see, we have a lot of overdoses, a lot of people dying. We'll have a high number of people who are going to the emergency room because of an overdose. Just painting that picture, you know, we're doing really bad. One of the worst in the states, and actually one of the worst nationally also. Next slide, please. Okay, so how is this happening? So from in 2017 to 2018, over that 24-month time period, about 33 million opioid pills were prescribed and dispensed to Cumberland County residents just over that 24-month time period. Just to put that in perspective, the big state of Texas has about 30 million people. So we had enough opioid pills that were dispensed in just a 24-month time period to give to every single resident in Texas, and then still have about 3 million left over. So we have a lot of pills. We're heavily prescribed. A big reason that is Fort Bragg, with a lot of wounded soldiers, veterans who have had surgery, just a lot of people in pain. But we have a lot of pills here in Cumberland County. We have about a 46 pill to resident rate. Again, that's higher than the North Carolina average. So we're doing pretty poorly in that area. But also heroin has become one of the biggest offenders. Heroin is very cheap. It is very easy, accessible, and with specifically Fayetteville being a very transient city, I-95 goes straight through it. It's just a breeding ground to have high levels of heroin. And then leading from that, a lot of the heroin that is on the street is being laced with fentanyl. for one of two reasons. A lot of the importers from out of the country there's actually a shortage from Mexico and China with heroin. So they're actually adding fentanyl to the heroin to stretch it out. And also the dealers that are here are adding fentanyl to the heroin to increase the high. The problem is that fentanyl is just so powerful that if people who are expecting heroin or used to just to pure heroin, when fentanyl is introduced, they're overdosing and they're dying. That's why so many people in the last couple of years are overdosing off of heroin, but a lot of it is being laced with fentanyl. So it's kind of a imperfect storm of things that are going on in Cumberland that makes it unique, and why the opioid epidemic is impacting it as difficult as heavily as it is. Next slide, please. Okay, so the WHO. So based on that, the year-to-date data, that 191 number that I have referenced before, from October 2019 to September 20, these demographics are based off of that. White residents represented 63% of those 191 overdoses, African American 21%, and then Hispanics, Asians, and American Indians all less than 3%. The African American number is interesting because that looks high, but actually it's in comparison to the actual percentage, we have a much higher percentage of African Americans than the rest of the state. We actually have, there's about 38% of Cumberland is African American, so that 21% is much lower. But the white residents being 63%, just like the rest of the state and just nationally, white Cumberland residents are significantly disproportionately impacted by the opioid epidemic, specifically white residents in their 40s and 50s. But recently, in the last 3 years or so, white males between the ages of 25 and 44 are overdosing and dying at much, much higher rates than any other demographic. Next slide, please. So that was just a brief update on how the opioid epidemic is impacting Cumberland. I'm just going to give just status updates on C4 and what the program is doing. Next slide, please. So what we've done, so because of COVID, of course, has made meeting in person, we had to push that out, but we've still been meeting monthly via Zoom. So we're still doing that monthly. We had our last meeting about 2 weeks ago. We're going to have another one in January. Earlier this year, we received federal grant funding from the Department of Justice and the Bureau of Justice of Assistance. And also staff members were hired. Myself, I was hired in October as the program coordinator, and the North Carolina Harm Reduction Coalition, who we partner with, they hired, I want to say 3 outreach specialists, 2 that I've met, and I believe 1 more is being hired. So that's what we've done. Next slide, please. What we're currently doing, so C4 is broken down by 3 committees. We have a healthy committee, a safe committee, and a support committee. Each of the committees, they have sub-goals that they accomplish that achieve the C4's greater arching overall goal. What the healthy committee are doing, they're currently assessing the referral and discharge process of substance use disorder providers, just to ascertain, what that process looks like. How are people identified? How long are they waiting from identification to treatment? What barriers there are just in that process. What does the discharge process look like? What benchmarks do they meet to be discharged? That's what the healthy committee is doing, sending out surveys to determine that. The safe committee, a big one for them, they implemented 3 mobile syringe exchange sites. So with intravenous drug use, a big risk factor of that is also hepatitis C and HIV and AIDS. So really what the safe committee is meeting these people where they are. They may not be ready for treatment, but at least let's let them be as safe as possible while they're using, because even though heroin is easy to get, clean syringes aren't. So a lot of times people end up sharing syringes between one another, heroin users, sharing syringes between one another, and that's makes HIV, AIDS, hepatitis C very likely. So these syringe exchange sites is just so that at least that until we can get them into treatment, we at least can alleviate the incidences of them getting, HIV, AIDS, hepatitis C, and so forth. And then lastly, the support committee, their plan for a recovery ready community is moving forward, just creating a community that's conducive to people in recovery, helping them with safe housing, job transition, destigmatizing recovery, and just making a community that allows them to be healthy and to have like a full recovery. Next slide, please. And so the next steps going forward, we're going to continue to meeting virtually via Zoom. Again, the next meeting is in January. Until COVID clears up, we'll continue to do that until it's safe to do otherwise. We'll be implementing an opioid overdose fatality review team so that people, if they have OD'd, just to determine what exactly happened, what is this person's story, so that we can get interventions to really better prevent the next person from losing their life. And then lastly, me as the program coordinator for the next meeting, just really going over the action plan with the C4 team members. I know COVID has really kind of jumbled a lot of things, and I know this is a really transition period. So just taking that as an opportunity to really realign everyone and just say that, okay, this is what we've done, this is what we're doing, and what are the next steps to what else needs to be done, and just kind of go back to our plan and just really just actually give like a clear view on what we need to do next. Next slide, please. And that, I'm sorry, that was actually all, there was another slide, but that was all that I have. If anyone has any questions for me, also Melissa Lawson, I believe, is on too. She is who I'll be replacing. So any specific C4 questions that I may not be able to answer, she's also here available also if there are any questions. And if not, then I think Travis is ready to take it away. Thank you, everyone. I'm glad to be here. Thank you.
Thank you so much for the update. We really appreciate your hard work.
You're welcome. Thank you so much for having me.
Does anyone have any questions for Mr. Jacobs?
No, this is Dr. Fleischman. I'd just like to add, I know that Melissa's on the phone, on the call, along with Mr. Jacobs, and Melissa's done a tremendous job to get us to this point, and Mr. Jacobs seems to be a great, and certainly is. I've had the pleasure of talking to him and working with him some, and think he's doing a great job in transitioning this program to the next steps. So I want to congratulate both of them about how far we've come and where we're going to go. So thank you for all your work. It's a big project, and we got to stay after this. Yeah. So.
Yeah, Melissa's done a great job. Thank you so much, though. Melissa's been really great for me personally and the program. So thank you, Melissa. I appreciate that. And thank you to Dr. Fleischman.
Thank you.
You're welcome.
Yeah. Dr. McMahon. Hi, this is Dwayne. And I also want to say, I want to echo everything that Dr. Fleischman said, and also say how important that I think it is that this effort lives within the health department. This is truly a public health crisis that we have in our community, and very appreciative of the grant, the federal money that we got to actually get full-time staff in place to continue this effort. But I encourage the board to continue to view this as a true public health crisis and emergency, that whether we have a grant or not, we need to advocate for resources for this effort. Thank you.
Thank you. So Mr. Greer is going to talk about the tobacco policy update.
Yes, thank you so much. My name is Travis Greer. I am Cumberland County Department of Public Health Regional Tobacco Control Manager. I serve a 10-county region, but in Cumberland, I am a staff of Cumberland and gladly serve Cumberland County in all things tobacco prevention and control. But good evening. Thank you for having me. I commend you on your interest in strengthening and implementing a tobacco-free regulation. And having a comprehensive tobacco-free policy and program is one of the best ways that public health can do to protect people from secondhand smoke. Research has told us over time that there is no safe level of secondhand smoke, and primarily that is what tobacco-free, smoke-free policies does for us. However, we've made great strides in tobacco-free, smoke-free policy regulations, but there are still an estimated over 58 million people still exposed to secondhand smoke at home, in the workplace, and in public places. So one of those great things that we've accomplished so far in North Carolina in the past decade are as you may recall, the North Carolina smoke-free restaurant and bars laws. That was a big win. And in this presentation, I'm going to briefly go review kind of the scope of work that Cumberland County has been taking over the past 5 years or so. As you see, as policies and systems and environmental change in public health, as far as what we know, it takes time improving health outcomes. And it doesn't always happen in a linear and beautiful fashion, right? But the fact of the matter is, as public health professionals, and as you see with the Board of Health over the time frame here, that we've kept the faith, kept our hand to the plow, and tried to keep working towards evidence-based best practice measures to promote and protect public health. And one of those tried and true practices are tobacco-free or smoke-free policies that are comprehensive. So as you see, in 2016, I did my homework and research, and many of you are part of the Board of Health or have been a part of this. The April 2016, the Commissioners Policy Committee received an update from previous Public Health Director Buck Wilson, and they presented that as a ordinance recommended by the Board of Health. They kind of got tabled because they wanted to see a draft ordinance, and they wanted the Public Health Department to do a little bit more background and capacity building with the city and municipality. So it really didn't, it come back to the table to October of 2016. And in the interim, September 2016, many of you may remember the vape product, e-cigarette, exploded in the Cumberland County Courthouse, and there's a video surveillance showing that. And so come October 2016, it kind of got brought back up. Buck Wilson and the Board of Health unanimously approved a recommended policy to go forth as an ordinance, came before the policy committee, and once again got tabled. So next slide, as far as into 2019 and 2020, let me get back over to there. Yes, the Board of Health chose youth and vaping as a priority to focus on that because of the surge in the youth tobacco epidemic, primarily linked to the uptake and e-cigarettes on the market. May 2019, the faithful leaders considered restricting vape shop and zoning ordinances. The Public Health Department and the Board of Health responded with a resolution. And resolution, it's a great first step in pledging our support, your support, but it's not binding. It is an official statement for whatever that recommendation or policy recommendation may be. So also in 2020, speaking of resolutions, you guys signed a great resolution, passed it on to the commissioners saying, we strongly recommend and support the exploration again in a stronger smoke-free or tobacco-free ordinance. So obviously progression has slowed as mentioned, and we get tired of hearing it as well, but it's here amongst us. March 2020, COVID hit, and then next slide, and it continues to hit, right? And so in July, one good thing this year too, our Public Health Department did receive 5 more years of funding from the Tobacco Prevention Control Branch and the CDC to continue to do tobacco prevention control in Cumberland County and the Region 6 region covering 10 counties. So it kind of in complementary to the 2020 resolution, vape shop zoning ordinances, our partnerships with UNC, Lineberger, Greensboro, we did present and develop a map of tobacco retailers and schools, just kind of trying to get an idea of what that could look like. So as of right now, that's slowly progressing, but it may still be an opportunity for us to impact public health and policy. And I just want to touch on November, I did present to the County Board of Commissioners as well and gave them an update on the tobacco epidemic. And Mr. Jacobs, he spoke of the epidemic of opioid use. We're in a pandemic, but we are still fighting epidemics of proportions that has been around for a short while. The tobacco epidemic has been around for quite some time. And next slide kind of gives you a sneak preview of what I shared with the Board of County Commissioners. And I feel like it made it relatable to where we're at in our day and time with COVID. I gave them a taste of, like, in times like these, we know what's best to protect us, right? The 3 W's, wait, wash, and wear. And now we can add the V to it, is get vaccinated. So there's a lot of education that goes on there. And it's kind of similar to tobacco-free and smoke-free policies. We have to do a lot of education of the why and how and why it's important. But from years of testing and trial, we know what worked with the tobacco control, right? And Brian King at the CDC, he has developed this kind of way to put tobacco prevention control work and hypothetically put it into a vaccine. We know vaccines help improve and protect people's public health. And these things you see in the tobacco prevention control vaccine, robust funding, tobacco price increases, Tobacco 21, which we now have across the nation, and our state is now beginning to really think of what that Tobacco 21 law will look like for us and how we can apply it. And easy access to treatment to those who want to quit. And where we are with this topic tonight is one of those things in this tobacco control vaccine that is field tested and evidence-based and practiced in the public health field, right, is 100% smoke-free, tobacco-free policies. And I'm going to touch briefly on that a little bit. So next slide, I gave them this update. As you may have heard, being public health and professionals, doctors, we have known there's been a linkage between smoking and respiratory illnesses, but there's no better time now to hit home the messages of it's a great day, a great opportunity now to make it quit it. And we're doing our best as a public health department promoting those opportunities through the 1-800-QUIT line and many different services that are available. So why does smoking increase susceptibility to respiratory illnesses like COVID? Because the nicotine that is in tobacco products, e-cigarettes, combustible tobacco, right? Nicotine increases that ACE2 receptor that is in the lung, and it just stimulates those ACE2 receptors, and those love to capture nicotine and absorb it to the body, but ACE2 receptors are very friendly and can catch respiratory illnesses like COVID-19 and so forth. So next slide as well, another wonderful reason to address tobacco control, tobacco prevention policies and so forth is the youth and vaping epidemic. That was a priority and still is a high priority for us to address. They found a preliminary study, as you can see listed there, that young people who have ever used an e-cigarette, they were kind of 5 times more likely to be diagnosed with COVID and so forth if they used dual types of tobacco products, okay? So like I said, next slide, I shared the tobacco prevention control dashboards within our region. I mentioned Region 6 several times. These are our regional counties that I serve and doing tobacco prevention control efforts. I think it's always a good opportunity to see where we compare to some of our peer counties. As you can see, the yellow colored shaded boxes are smoke-free policies. Those include traditionally just combustible tobacco products that include cigarettes, cigarillos, cigars, so forth. A tobacco-free policy is actually the gold standard policy that includes all tobacco products. So local governments have the authority to limit and regulate smoking on government grounds, buildings, vehicles, and so forth, as we'll see on the next few slides. And next slide, as you can see. And we did get that question of why Cumberland County government grounds were not shaded in yellow. It is because there are a few exemptions on certain government grounds where they can people can still smoke, like the Crown Complex, like Parks and Rec grounds and so forth. So these are the municipalities, our wonderful municipalities who make up the heart and the soul of our county as well. That is where they stand in regards to tobacco-free and smoke-free regulations. So moving forward with local government authority and the Board of Health authority to make rules, you do have the authority, and so do the commissioners, to create a rule, as you suggested in their resolution, to as far as, we can go to the next slide, please, to regulate smoking on government grounds. We have that. That is wonderful. That is great. it could be stronger, and whatever the Board of Health likes to do, we have provided a model policy to be a guide for us. And there may be opportunities to do that. And as far as regional manager and all the partners and technical support that we have in our purview here, we can make it happen together. So next slide. Local boards of health, as you know, as a reminder, you can adopt rules to protect, promote public health, not just with tobacco control, but it could be anything, just about. However, with tobacco control, if you adopt a Board of Health rule regarding tobacco use, as Ashley and Dr. Green mentioned at your last meeting, it does have to go before the Board of County Commissioners to be approved and passed. That is one of the only Board of Health rules, very few that have to do that. So, so next slide there. Okay. Those are the exceptions there. I just mentioned those, right? And this Board of Health rule can apply in all municipalities. However, is probably best practice, as we've learned, other counties doing this to engage other municipalities throughout this process. And that's what we hope to do in the time frame coming up alongside of you guys. Dr. Green, I believe, has shared this model policy with you via email. If not, she can reshare that as well. It does sit on the Tobacco Prevention Control's website, and there's a wonderful tobacco prevention and smoke-free, tobacco-free policy playbook that can help us guide us along these processes. And we also have great staff at the state, local, and regional level to help us out and see where they've been, how they've done it. So next up, we've kind of put together a general time frame of how could this move forward in the best fashion. Dr. Green and Dwayne Holder has already been in conversations of what they could do as building capacity and understanding. Okay, talking with the commissioners, we do have a new board of commissioner that was newly elected, kind of getting her acquainted and getting to know her, providing education on policy options that exist. So so next up, I've been asked by Dr. Green, she mentioned last time, alluded to, attending the mayor's coalition, so I can have an opportunity to present something similar to them in January and kind of get a feel for what they are feeling. As you saw the dashboard, that they many of them did not have a written regulation that we have that we currently know about as well. So maybe they would like to come alongside the Board of Health rule and adopt that with us as this moves forward. And they can already probably adopt our smoke-free rule as well, that is already written to mimic in their municipality. So next up, yes, begin reviewing this Board of Health policy. What is your deal? What do you want to see in a comprehensive smoke-free, stronger smoke-free or tobacco-free rule for our county to protect and promote public health, right? What is your deal breaker? What is our line? We're doing this primarily to protect the approximately 80% of non-smokers in our county from the harms of secondhand smoke. I know many of us have been at home with COVID and all those things, but that has been found one place where people do get exposed to a lot of secondhand smoke. But our policy is also regulating potentially in the places that aren't covered, parks, some maybe possibly public places, whatever you guys decide. So I can also assemble a team. We have partners who have a stake and interest in tobacco prevention and control work. Bring those team members together, pull our heads together and make this happen and be an effective opportunity for us. So next up, I want to close with this. I've been a part of, I think I went ahead for you there. Yeah, keep going, one more slide there. So I've been a part of this November, I could have included in the timeline, is we are receiving technical assistance from the North Carolina Association, not the North Carolina, the National Association of Chronic Disease Directors on a webinar series called Closing the Gap. And I've got a lot of great information from that series of webinars from the Americans for Non-Smokers' Rights and a couple groups there facilitating that. So if you go to the next slide, one more slide, it's a quote that I captured and I like it. It's not so much about, and I tweaked it a little bit, it's not so much about the will to win, but it's about the will to build the capacity to win. And our public health department has been building capacity to fight this COVID epidemic over this almost past year. And we're ongoing building capacity with partners and with you all to make opportunities to live healthier, breathe tobacco-free air throughout our community. So I think it was quite appropriate, as you may have seen this past week as I finished this last thing. The new Cumberland County branding and logo is quite appropriate for the time we are in these days with COVID and this presentation tonight. The tagline reads, "Together we can." And this new tagline, public health, we know it takes a variety of stakeholders to get us progressing towards policy and better public health outcomes. So together we can build capacity and make progress for a healthier Cumberland County community. So I thank you for your time. You see my information there. If you have any follow-up questions, you can get this PowerPoint for more resources and links that I provided on there as well. I'll field any questions that you have at this point in time.
Thank you so much for an excellent presentation. We look forward to hearing your, the outcome of your meetings with the mayors and the commissioners.
Mm-hmm. Yes.
Excuse me, Madam President.
Yes.
I need to be excused. I'm at work and I'm being paid.
Thank you so much for joining us.
Thank you. You all
Have a
be
good
safe.
evening.
All right.
Does anyone have any questions for Mr. Greer?
Just a quick question, Mr. Greer. What are your thoughts about online sales of just vaping and tobacco? Seems that I've heard that some websites, a lot of the good websites, they'll require, the picture ID or the license, which makes sense for someone at age 18. But some of them, they just basically have them just write their name to basically state in good faith that they are over the age of 18. Not sure who to even, this is kind of relevant for us, such as, a small entity, but what are your thoughts about that?
So my thoughts about online sales is that, did I hear you correctly, and on just adult or general access to purchasing tobacco products online, primarily vapes, right? Our Surgeon General, and his name's Stein, Josh Stein, he has done quite a bit of work over these past year or two in that effort, and as far as nationally as well. There's been a lot of lawsuits and litigation as far as strengthening security on purchasing online, and as far as you can imagine, the World Wide Web, on how comprehensive an approach it is to regulate and to make retailers online do what they're supposed to with security checks and submitting true documentation to verify they are of age. And you could probably read more, and I can get more information, follow up with you about that, of the efforts that Josh Stein and our North Carolina Attorney General, and even at the national level, what they're doing to try to mitigate youth access of vape products online, purchasing those. So. Mm-hmm.
All righty. Thank you so much. All righty. So with that, we'll have Dr. Green present her report.
All right, good evening, everyone. I will start per the usual with our numbers of COVID. So this does not include our numbers from today. This was information that was pulled yesterday. So we've topped 1,200 or 12,000 cases likely today. So our numbers continue to increase. That's not a surprise to you. And our trends are quickly increasing. And so we're seeing the results of Thanksgiving holiday. We're about 3 weeks out from Thanksgiving. So we're really hitting those numbers hard now. On the next slide, you can see the North Carolina County Alert System. So this was created by the State Health Department as a way to track the level of community spread in county by county. So this report was released last week. It's a bi-monthly report, twice a month, that comes out from the State Health Department to show the amount of community spread. Cumberland County is in orange. This is the second iteration of the report. The first iteration, we were also in the orange, so we had no movement. And it's based on a couple of metrics: a hospital impact score, our case positivity rate, and then our cases per 100,000 population size. So we'll look at those numbers in just a second, but I want to note that from the first report to the second report, a number of other counties shifted from orange to red. We were able to stay in the orange. However, if we took those metrics today, we would likely be in the red. So on the next slide, we can kind of see some of those. Again, this was from yesterday, so not including today's numbers. But in the last 7 days, 477 cases. In the last 14 days, 1,046 cases. On average, we have 66 cases in a day, although I'd say that's a little bit low. In the recent days, it's more 100 plus cases in a day. And then, or that's our daily average of cases. And then our daily average of cases per 100,000 is 41. So our case positivity rate hangs out around above 10%. So when I looked this morning, it was at 11.4%. If we wanted to remain in the orange, we'd have to get our case positivity down below 10%. So next week, when we put that number, when we share that information back out, we'll have to look back at the state metrics, but it depends on our case positivity rate. If you tip over into the above 10%, that's when you move into the red. So just putting that out on their radar. The good news is we are increasing our capacity for testing. So this chart shows, again, week by week, the number of tests that we've done county-wide in Cumberland County. And so our numbers continue to increase. We've had weeks where we've passed 8,000 cases. The goal is to test at least 5% of our population every 30 days. And that works out to be about 4,200 tests a week. So again, that doesn't account for people that get tested twice or on a weekly basis. But in general, this is a good snapshot of the amount of testing that we're doing. So we're continuing to increase our test capacity. And then also remember that last bar on those slides are always a week behind. So because the data gets pulled down in the middle of the week, it always lags behind on that very last week on the chart there. So that last bar will actually probably increase over time. So in terms of number of deaths and cases on the next slide, we have more than 1,600 active cases. Our death count actually ticked up to 132 today, and most of our cases have recovered. When we look at our deaths, this is very similar to what we presented last month. Most are over the age of 65, male, African American. Most have been hospitalized, and most have comorbidities. A little less than half were in congregate living settings. So that number has sort of bounced around a little bit. But I think that's important for the public to remember that it's not just our individuals that are living in nursing homes, it's our individuals that are living at home as well. Okay, so what you are all here for tonight is our COVID vaccine update. So I will start with the framework for prioritization. And I know that this is a little bit challenging to see, but we will share the slides out. So and a easier to read version of this is on the state health department's website. So the priority really is to, in phase 1A, which is where we are now, to get our healthcare providers and our healthcare workers vaccinated. So if we, we'll hang out here for a second. So in phase 1A, are anybody that's caring for COVID patients or individuals that are serving COVID patients, are working our vaccination clinics, are working in our long-term care facilities, are living in those long-term care facilities. That's where we're focusing on the next couple of weeks and months. And then in phase 1B, we move into those that are in high-risk settings, our people are homeless, our migrant farm workers, are people that are incarcerated that are in those sort of high-risk settings. And then we move into phase 2, which is more general population and thinking about still those high-risk settings, but maybe you don't have a chronic condition. So we'll go to the next slide. So a little bit about what we've been doing over the last month. the state health department has launched a COVID-19 vaccine management system. We call it CVMS. We are getting to know it very near to our heart. We've been working over the last week to get staff trained in the system, and we expect to be able to have access to that system sometime this week, and being able to launch and go live in the system. So that is the system that the state health department is using for us to ship and receive the vaccine, for us to be able to register, and then also for us to be able to vaccinate people and track our distribution. So a few other things that we've been working on our side, as we're sort of planning, as we mentioned last month, to either receive Pfizer or Moderna. So making sure that we have the appropriate to be included, making sure that we have dry ice capabilities, and that we have a supply chain in place for that, making sure that we have our any other supplies that we need, making sure that we have our cooler, our gloves, our PPE, our face masks, making sure that we are ready to go. The vaccine comes with ancillary kits, but those are just sort of an initial supply of what we need to vaccinate. So we want to make sure that we are well stocked and well prepared. And additionally, again, I mentioned the dry ice. That is, I've thought more about dry ice in the last probably 2 weeks than I have in a very long time, or I ever have. We've also been working with PIO to make sure that we are doing, Kelly, can you go back to one slide for me? Making sure that we have our communications plan in place. So the state health department is also preparing a communications toolkit. The CDC yesterday, I believe, just released their communications toolkit. So we're working on making sure that we're having good communications with the public. We've launched we will be launching a COVID-19 vaccine website so that people can go. So that will be. I'm going to pause, and if you are not muted, if you could, fine. Perfect, that did it. Thank you. So right now, we're making sure on our backside, making sure that we have staff ready to go. It's fairly close to go time for us. We're going to make sure that we are ready to roll when vaccine gets here. So we are also working on getting our vaccination clinic planned out. We don't yet know. I expect to hear any minute now about how many doses of vaccine that we will get and when we will get them. And we don't have that information yet, but as soon as we have it, we will make sure that we are able to share that out. As you saw in phase 1A, now I'm ready for the next slide. Thank you. On phase 1A,
Sorry, Dr. Green, hang on 1 second. Can somebody please mute their phone or their computer, please?
Tell who it is on our side. We're trying to mute people. Yeah, if you're on the phone only, we can't mute you. So if you're on the phone, go ahead and mute yourself. Thank you.
Yes, I've got both, but I've got my phone muted the whole time except when I'm speaking.
Yeah, we can hear you clearly, so I don't think it's you. Whoever just muted yourself, thank you, appreciate it. So hospitals and local health departments were enrolled first as providers. We've been getting a lot of questions about when other people will be able to get enrolled as providers. We are hoping to hear from the state health department in the coming weeks about how other providers will be able to enroll so that they can help us with our vaccination plan. But until supply is more readily available, again, local health departments and hospitals are our providers right now. So week 1 of allocation started this week, and there's a Cape Fear Valley Hospital press release today. They received their vaccinations. I think Dr. Fleischman, you got vaccinated today, if I read the press release correctly, and they received the Pfizer vaccine. Next week is what we call week 2, and week 2 allocations are coming. Again, we don't know what we are getting for the health department, but we hope to know that any day now that we will know more about what we will be getting. So our first task is to make sure that we are vaccinating the vaccinators. So that includes our public health staff, because our staff, as I mentioned, We are working on getting them trained, our entire staff ready to go so that they can be deployed to help run our vaccination clinics as quickly as possible. And so we'll be able to get them vaccinated, and anybody that is helping with the vaccination efforts are getting vaccinated first. After that, we are also in phase 1A, of course, are our long-term care facility staff. There was last month I mentioned the partnership between CVS and Walgreens and the federal government. For any of the programs that the long-term care facilities that did not enroll in that program, we will also make sure that we're getting those individuals vaccinated. We'll also be vaccinating our first and foremost, our healthcare workers that are directly caring for COVID patients. That includes our emergency management staff and our EMTs, and our funeral homes that care for COVID-19 decedents. So we have some people in phase 1A that we are working on. We've been getting many questions from healthcare providers about how do I get my staff enrolled and get them ready to get vaccinated. If you just be patient with us as we get more information from the state. Like, as I mentioned, there's a new system that we're working in. And so as we get more information about how to enroll people to get their vaccines, we will share that out just as soon as we possibly can. And people will be able to, at this moment, not make an appointment, but we anticipate that will be capable very soon. But just hang tight with us if you are a healthcare provider. We will be getting that information very shortly about how you can get your staff trained. As we move later into the phases, we'll have more widely available public vaccination clinics. But right now, we're doing targeted point of dispensing sites so that we can make sure we get those phase 1A people vaccinated as quickly as we can. So again, it's a week by week allocation. Go back one slide for you, Kelly, thank you. The week by week allocation. So we anticipate that each week we will learn about what we are getting for the following week. So we know that turnaround time is going to be fast for these vaccines once we get them, and that we'll be able to get them out of our door as quickly as we possibly can. So we get, as we think about what's happening week 3 and beyond, we'll get doses, for example, in week 4, we will get doses for people's first dose, and we will get doses for people's second dose, their booster doses. So we are working on making sure that we have that system in place on our side. The federal government has done their part to make sure that doses are allocated, and we'll distribute those accordingly. So I'm going to pause there for questions. I just want to give a high level overview. I know there are likely questions about how we're going to roll this out.
I can add, I mean, you commented, and at Cape Fear, we were very excited to be on the leading edge to get and have the freezers to receive the Pfizer vaccine. Cape Fear Valley Health in Cumberland County, as well as Harnett Health, Bladen County, as well as Hoke Hospital, all received allocations, and we received our first allocations today at Cape Fear. And as you said, I got my dose, and I'm still here, and nothing bad happened to me, and I'm doing just fine, just so you know. And we're very excited to be rolling this out to all of our employees tomorrow, and our medical staff, Dr. McMahon, just so you know. And today and tomorrow, tomorrow and the day after, and then on Friday. I will say that, what happens, and as Dr. Green has alluded to, this has been a rapidly developing situation about how we allocated, how many doses you're going to get, and how you distribute it, and it's been very fluid. But I want to say that because of our capacity with these freezers and the Pfizer vaccine and our wish to make sure that all the community gets as much vaccine as fast as we can, we certainly want to partner with the health department, like Cape Fear Valley Health, partner with the health department, because the health department's primarily to get the Moderna vaccine because of the issues around its shelf life and its instability. That it doesn't require as much freezer time, and it can stay out at lower temperature. It can, sit out for longer periods of time, and still be usable. So there's challenges, and that's why a lot of the Moderna vaccine is being directed to the health departments. But we can continue to get Pfizer vaccine if we use it all on a weekly basis. So we've really got to work well together to make sure we maximize our opportunities here to really make sure our community gets vaccinated as quickly as we can. And just to speak to the other side, we are at really crisis situations in our health system. We were up to 79 inpatients in the last week. We're down to 73 today. Before Thanksgiving, we were averaging in the mid-40s, and now we're at 79. And I don't know where we're going to be at after Christmas, but we are taxing our health system. We are down 50 beds because of staffing, and the COVID patients stay longer. So we're functionally down almost 100 beds, 100 patients a day that we can't take care of, and our ED is filling up, and we're understaffed. So I don't want to, I really want to alarm everyone that we really got to push people's willingness to do the 3 W's, right? And do that. Wash hands, wear your mask, socially distance, or wait, or within 6 feet. But we've really got people. I was at the grocery store this evening. Nobody is heeding the call. Nobody. I mean, there's more people out shopping. There's more traffic on the highways. I am really concerned what's going to happen in the next 60 days in our community, because there's nowhere to go, because all the other health systems across the state, including UNC and Duke, they're all strained. So I just want to let you know that. And if you can, I hope our governor will get stronger, but our county commissioners need to understand where we're at right now and what's going to happen in the next 60 days. We're doing everything we can, and we're following our crisis management plan, and we will continue to do that. And we're going to take care of people as best we can, and we'll stretch our staff as far as we can, and we're just pulling out all the stops every which way we can. But it's getting strained. The health system's getting strained.
And I'll echo that. And on a couple of things, right? This is outstripping our ability to do contact tracing as well. When we have 100 plus cases in a day, 150, 160 cases in a day, we can't contact trace our way out of that. And I hope I'm not speaking on behalf of your staff, but I'm going to, that we need the public's help to do this. Our teams can't do it by ourselves. The vaccine is great. We're very glad it's here. We've been planning and preparing and collaborating with the hospital team to make sure that we can get it distributed as fast as we can. But that doesn't mean that we stop doing those 3 W's. We have to do that together as a community, or we won't be able to. We don't want to get into a place like other states that have just said, we're going to not do contact tracing anymore. But we have to be able to get our numbers down so we can get a better handle on those cases.
And Dr. Green, I'll tell you, our positivity rate in RED right now for testing is up to 20%. So it's very high.
Our numbers
right
are
now
too high. I don't know how to say it different. I don't know how to say it differently or better. But we're just urging. We're a week out from we're already in the holiday season. Less than a week out from people starting to travel. We need people to stay home. We saw what happened at Thanksgiving, and I'm with you, Dr. Fleischer. I'm not sure what's going to happen after the Christmas holiday, but it's a little bit nerve-wracking to think about it.
Yeah. So Dwayne, I don't know what you got to tell our county commissioners, but and the health department team what we got to say, but it's concerning, very concerning.
Certainly, I'm making notes as I'm listening, and will certainly be conveying that.
I have a comment. I don't understand why the governor doesn't roll back to phase 1 where everybody's supposed to stay at home. Because it just seems like there's no way to get control of this. People don't want to wear the masks, so they should just stay home. I know why, but it's just, I don't know how much longer doctors and nurses can keep up this pace of working, 14, 16-hour days. And it's so hard on everybody. I don't know what the answer is. Even if you have the vaccine, like you say, people still have to wear the mask, and they're not going to if they're not wearing it now, having the vaccine is not going to make them wear the mask. So I just don't understand. I don't know what to do. I don't know. I think the only answer is to, lock down everybody again. I think Germany is locking down tomorrow or, sometime next week. But this is just, people just won't listen. And they just not got to stay home if they can't wear the mask. It's my opinion.
And the great point about the mask, and I don't know what the governor is thinking or on, or what will happen with restrictions coming forth. I know he hasn't taken it off the table, but I just don't have that insight. But we are trying our best to respond to complaints. It is Kelly's over here nodding off camera. We are fielding complaints from the public, and we try to make sure that we are following up with businesses that are not enforcing the mask mandate, restaurants, retail stores that are not enforcing social distancing, whatever that entity is, making sure we're doing some pointed follow-up. But again, we need people to, we're sort of playing whack-a-mole here. We can't, that's not the strategy out of that. We need people to help us comply with the mask wearing so that we can get this under control. Are there other questions? I'll say one more thing. We've got a lot of questions about vaccine safety. So as we get information about whether we're getting Moderna or Pfizer, we will roll at the test site or at the vaccination site. People will get the information about the EUA, the emergency use authorization, for whichever vaccine it is. They'll get that in their hand so that they can review that safety data for themselves. In addition, the CDC has a smartphone app that people can go back through and track their any adverse events. And then in addition to that, I believe the CDC has a strategy to call people to check on them as well. So there is a mechanism in place to make sure that we are, the vaccine is safe and that we're tracking safety over time.
I will say that the login process for the state, once you get enrolled, is not too bad, as long as the system's not crashing. But it's a good system.
That's what we've, as I said, we've done some initial training, and it looks like once we're able to get in it, it's fairly easy. We anticipate that it will be a quick process, but we just have to be able to get sort of onboarded, and then we'll go out there and do, as Dr. Fleischman said, and get our staff vaccinated and then be ready to go for those phase 1A individuals.
We did a lot of work on our media campaign this weekend. Today we had a lot of people to really try to reinforce that this is a safe vaccine, it's effective, and we certainly got a lot of our medical staff and certainly had a very, very inclusive staff. We had a lot of female physicians, people of color, to make sure they knew it was a safe, effective vaccine and they were willing to get the vaccine done. And from all walks of life and work, that were people that were working with COVID-19 patients in all disciplines, from our environmental services to nurses to doctors to transporters. We all had them there. So.
And that's a great point. One of the things that the state health department is working on is doing some research to share with us on the communication side about who's not getting, who has vaccine hesitancy, and all those groups that you just named, females, young, African American, were the least likely to say that they would get vaccinated. So it's about us as the hospital system and us as the health department being able to build that trust. And I feel like we've been doing work all along during COVID to make sure that we have that in place so that people feel safe getting the vaccine and sharing information as we have it. The only other update I have, and it's in your packet, and I'm looking at the hour, is the update from the Women's Health Branch. Last month, the board asked to do a follow-up on our report from the Women's Health Branch to see what programs we have done, or what programs we are doing, what programs we're not doing, and the reason why. So that was included as a supplement to your packet that Kelly sent out earlier this month or earlier today. And I won't read you the document, but our state health consultant also provided feedback on this document so we could see the programs that we're offering. One of the things that you'll note is that several of the programs are either not offered anymore, the funding ended, or they were very targeted efforts and didn't include Cumberland County, or they didn't have, they were targeting a different county or a different population than Cumberland County. But hopefully that provides some context for the programs that we are providing and the ones that we're not, giving a little bit of reason why we aren't doing that, providing this program. So if there are any questions about that, I'm happy to answer, but that is in your packet. And if nothing else, Dr. McMahon, that's all I have.
Thank you so much. Were there any comments at all from any of the board members or anything that anyone would like to have discussed at future meetings? If not, we want to thank everyone for joining us today. And again, congratulations to Dr. Olusola and Dr. MacArthur Kearney for our new leadership starting in January. Thank you everyone for joining us. Meeting adjourned.
Thank you. Thank you very much.
Okay.
Thanks. Okay. Just going to congratulate Dr. McMahon. I guess we'll do that in January a little bit more about all her great work and leadership over the last 2 years, but don't want to minimize that and wish everybody happy holidays, but we'll do some more of that in January perhaps. So,
yes,
all
we will.
Happy holidays. All right.
Thank you.
Happy holidays, everybody.
Thank you.
Good night.
Good night.
Holiday.
Good night.
Guys. Bye-bye.